Just to go over what you're going to need for this class, you will need a set of blocks, your foam pad, your cushion, short loop band, lightweight for today's class is fine, a strap, low chair or stool, and you also need a Pilates ball, or if you don't have a Pilates ball, you can definitely use your cushion. Okay, so today's class is primarily focused on lower legs, and we're going to also be doing lots of rotation in today's class. And the idea for today's class is to really help you sort of untwist your body, but also get it loading from the ground up. And essentially when you get both of those things working as well as they should be, you will start to feel way less symptoms, particularly in major parts of your body. So think lower back, hips, pelvis, neck, shoulders, and even your legs, obviously, primarily ankles and lower legs as well. Okay, so we're just going to start with balance test. This is an hour's class, so it's a bit shorter than what we normally would do. It is a lunchtime class, it's a new time, but the format is very much the same. We're starting with balance test and then moving on with our exercises. So once again, just checking in with your body. For me, this is like the most important part. I came down this morning at about 10 to 6 or whatever that was, just to go over this routine. And when I started with my balance test, within the first few minutes, I could just check in with my body, check in with what's going on, and it gave me so many answers as to why I'm feeling the way I do. So just really reminding ourselves of how powerful this balance test can be. You're just shaking off your hands, your legs, keep your eyes closed. And I don't want you to bias your body when you come and stand still. So I would just march out the legs a little bit higher, keep your eyes closed, and then settle down into your feet. And just let your body do whatever it needs to do. Stand without having to feel like you adjust yourself manually. I want you to just let your body do whatever it needs to do. And as you start to just connect with your body, just taking a few breaths in through the nose, out through the mouth. Start to take your attention down towards the feet. First, you assess which foot you feel more of your body weight, right or left. It may be very obvious for some of you. It may be more into the heels or the toes for some of you. For some of you, it could be one heel versus the opposite toe. And for some of you, it could be more towards the insides of both your feet, outsides of both the feet. It could be one or the other in each of your feet. So you're just checking in with where that's at. Working up through the legs, so you're going towards the knees. Sometimes you can feel one knee knocking in, you'll feel one knee extending, you'll feel both your knees bending. Whatever the knees are doing, check in with that. Going up towards your thighs, pelvis, hips. Could feel tight, so it could be a sensation that you might be feeling. But in these balance tests, usually it's a positioning that you're looking for. So it could be that you feel one hip swayed out or twisted forwards. You may feel like a little bit of lower back tightness. You could feel tightness in your hips. Whatever you're feeling in that area, just check in with it. You're just banking that information. And then work up towards your trunk, your belly area. Do you feel like you've got tension in the abdominals at all? Check in with that also. Some of us could be the pelvic floor. Check in with one side of your rib cage versus the other. So I do feel like, I feel that there is a big difference in my right and my left rib cage today, so I'm really aware of that. It's like my left side just feels like it's really sort of compressed. Like if I took a breath, I can feel more my right side of the rib and my diaphragm than my left. And then work your way up to your shoulders, your arms. I feel like my left side is really stuck in the upper side of my collarbone, my chest area, my pec area. Everything in my left side's just feeling pretty restricted today. My arms feel pretty good. My shoulders feel pretty good in terms of being pulled back. For some of you, might feel like it's rounded. One arm feels away from the body than the other. Feel the tension in your hands. It could be that you're clawing your hands or your fingers feel tight. That's also very relevant information. And then lastly, your head, your neck, your shoulders, tops of the shoulders. And if I just give you my feedback, I just feel like my head is completely out of whack. It's like tilted but also twisted at the same time. Right side feels like it's long and left side feels like it's compressed. Good. And for the purposes of today's class, and just to give you an indication of how we proved to ourselves that this class could have a benefit into our body today, we're just simply going to come and stand with our toes turned in, heels out just slightly. And then we're going to bring our hands just across the chest. So you're going to have left hand down, right arm over. And very gently, very easily, nothing too pressured, I want you to take a small rotation to your left without moving the lower body. And just breathe in this rotated, sort of loaded position. We're just going to take a few breaths here. Inhale. And exhale. Big breath in. Exhale. Just keep breathing in that direction. So the twist of the arms doesn't really matter. I just kind of gives people direction just to make sure you switch. Good. That's it. And you're just trying to, with your eyes, also look in the direction of your rotation. Okay? So the eyes and the sensory sort of input really matter. You've got left arm under, right arm over, and we're twisting to the left with just our upper body. And my gaze is going to be over into this left side also. We're here for just another minute. Long, big breath in. And big breath out. As soon as I do this, I do feel something in my neck release. I'm feeling something in my head kind of like releasing. So whatever's happening, if anything's happening in your body, just let it. Last 30 seconds. One last time, big breath in. And exhale. Good. Just drop your arms. Just shake off the legs, shake off the arms. If you feel a bit lightheaded, it's not uncommon. So just shake it off before you switch sides and then come back into that position, toes in, heels out, pigeon toe position. And switch your arms. So you're going to have the right hand low, left hand over. And it'll feel a bit odd. Like I just feel like my hands can't even catch my shoulders. It's a bit funny. And then you're just going to turn to the right. And again, notice, do I have different capabilities? For me, turning to the right feels really, really easy. Try to feel the big toes down, the balls of both your feet down, pinky toes, heels. Your gaze with the eyes is over the right, not past the shoulder, just in front of the shoulder. It's about 10-20 degrees away from center. And what I'm noticing in my body is my body, upper body feels like it's rotating, but in order for me to do that, my left foot doesn't stay on the ground. So I'm being really aware of, okay, my body's being asked to rotate, but my feet can't stay on the ground. So where else then do I put this compensation as I try to rotate? It'll probably be in my QL area, my lower back, maybe my neck. It could be in my hands. I'm feeling some tension in the left hand. So whatever you're feeling as you rotate like this, just bank that information again. Because we will repeat this function test at the end. And the idea is that you should feel the feet more grounded. And you should feel like actually I rotate with less compensation. And so what will happen at the end of the class is you're achieving a sort of much more smoother range of motion. by loading into the feet, establishing a base of support, and allowing the trunk to rotate on its own without you having to do something to rotate. Let's just take a nice quiet minute here just to breathe in through the nose. Relaxing the elbows, relaxing the chest. No pressure in the hands. Just keep breathing and feel the rotation coming only from the rib cage. Again, my head is releasing, and I can feel something in my left leg release as well. Just keep breathing. Last 10 seconds. Good, and release. Good. Walk it off. And just for your own sake, very quick, simple balance test again, and see if anything's changed for you. You're just going to come back into your standing position, nice and relaxed. So my balance overall still feels great. That sort of tightness in the left side of my upper pec area shoulder seems to have gone. There is still some feeling of compression in the diaphragm area, but overall that left side of my chest feels like it's opened up. And my head doesn't feel as wonky. So I'm getting already some signs that this routine is definitely going to help me in various ways. So from here, all you're going to need to do for this first exercise, you're going to need your Pilates ball or your cushion. You're going to wedge it right into the center between your knees, not in the thighs, but right between the knees. Okay, and then from here, just find yourself up against a wall, heels touching the wall. Even in front of a door, you can use a door if you don't have a bare wall. And I want you to just feel like the ball between the knees is just being held. It's a bit of a squeeze. With your feet hip distance, have an awareness of the feet being parallel, so pay attention to what position your feet are in, and just bring yourself to stand up against the wall. Heels touching, try and get the shoulders and head to touch, but not by forcing, more by positioning, okay? So forcing would look like I'm really tense and I'm trying to squeeze everything to the wall. I just want you to feel the 3-point contact of your feet into the ground. Arms are completely relaxed, and just be where your body needs to be as you stand with your heels touching the wall. And then relax your abdominals. Keep your gaze neutral. And just breathe here. In through the nose. Exhale through the mouth. Inhale through the nose. Exhale through the mouth. I want you to feel like you can relax both your knees. But relax not meaning bend them. Relax meaning let them pull back till whatever degree that they can. Again, my head is releasing, my arms are releasing. So whatever's happening in your body, just let it. Just keep focusing on your breathing. Keep trying to feel the feet down in the floor. Shoulders back. Gentle squeeze of the ball or the cushion. We're here for another 1.5 minutes. My arms are releasing. Just keep breathing. Whatever's happening in your body, just let it. Just come over to the screen. Nice. Yep, keep going, Mehul. I can see those arms and shoulders almost trying to feel like they release. Just let them do whatever they need to do. Just keep breathing. Nice. Feel the 3-point contact of the feet in the floor, heels, pinky toes, big toes. Just keep breathing. Good. Last 15 seconds. Good. Now you're going to stay where you are with the ball between the knees, and you're just going to march the arms in a half cross crawling, okay? So from here, left arm stays down by your side, right arm's going to reach forwards. Feel like you're protracting the shoulder away from the wall, right fingers are wide, and then bring the right arm all the way up to touch the right side of your ear. Your rib cage stays down, so we're not popping the ribs forwards. Reach that right arm 1 inch higher towards the ceiling. Feel like you're moving that rib cage. And then right arm comes down, the left arm reaches forwards and left. And with this view closer to the camera, when my arm gets up towards my left ear, I'm going to feel like I'm reaching it up 1 more inch without laterally tilting. And then switch it. Left arm comes down, right arm left. Exhaling. Right arm down, left arm switch and lift. My head stays on the wall if it can. In other words, I'm not trying to move my head to move my rib cage. Right arm lift, left arm down. Right arm down, left arm lift. And switch. Nice. See if you can find some fluidity as the right arm comes down, your left arm lift. Left arm down, right arm lift. Right arm down, left arm lift. Keep the fingers wide. Imagine you are splaying those fingers all the time. Good. And I want you to feel like your arm moves in the plane of the shoulder, not wider. So you're not allowed to abduct the arm away from the body. Good, and down. Inhale to reach the arm up, exhale to swing it and switch. Let's go for 4 more here. 1. That's it. 2. Good. 3. And 4. I want you to hold the left arm up. Big breath in. Keeping your butt to the wall. I want you to peel this left arm over towards the right side as if you're throwing something over in the diagonal. And then you're going to take your gaze towards the outside of the right foot. And imagine someone's pulling this right arm down towards the floor. Tuck your chin down towards the throat. Left arm back up, big breath in. So from the front, this is what it's going to look like. I'm standing here with my heels to the wall, left arm is up. Imagine you're throwing yourself over towards the right, look down towards your right foot. And then all the way back up. Okay, so if I had my back to the wall here, as I reach, I also peel that shoulder off the wall and down. It's like a half curl and then back up. You reach the left arm up, over, and down. And you should feel like something is reaching in that left shoulder and the left rib cage. Can you feel it? Okay, so right arm stays down, right finger's wide. Left arm reach, up, over and down towards your right toes. That's it, Mel. Feel like you can reach that left arm for the door forwards a bit more. That's it. Keep reaching forwards with the left arm. Down more, more, more. There you go. And then back up, big breath in. And then over and down, exhale. Good. Inhale back up. We're going to do 2 more on this side and then switch. Nice. Exhale. So the left side of the butt and the top of that left hip stays on the wall. It does not peel. Your gaze should be down towards your right foot as you reach this left arm away. And then inhale back up. Big breath in. Up towards the ceiling with the left arm. Over and down. Good. Last one. Long big breath in. Exhale. Reach it over. Good job. Release the left arm. Just give yourself a second to settle. Keep the ball between the knees. Whatever happens in your body, let it. I'm having a lower body reaction to this. My arms are also still releasing, but whatever's happening in your body, just let it happen. So many of us have ribcage disparity, ribcage compensations that are created by shoulder and pelvis, also your feet not doing what they're supposed to do. So with this exercise, we're just kind of removing some of that as we clear up some space, then to reload, realign the body. And then from here, we're going to lift that right arm up towards the ceiling. Spread the right fingers nice and wide. First, I want you to reach up to the ceiling 1 inch. Create length in the right rib cage. And then you laterally shift as well as rotate over towards the left. You want to feel like someone's throwing a ball over towards the left side. Left arm is limp, but your gaze is down towards the left ankle. Each side is going to feel really, really different. Big breath in and up with the right arm. Up towards the ceiling, create space in the right side, and then lean and rotate over towards the left. Amazing. Long big breath in and up. Over towards the right side. Reach it away, reach it away, reach it away. Feel like the upper body comes off the wall. It's just the back of your glute staying on the wall. All the way back up. Big breath in. Exhale, reach. Big breath in, right arm reach. Exhale, over. Good, we've got 2 more on this side. Long big breath in, reach the right arm up again. And over towards the left. Your head will come off the wall. Upper body off the wall. Right arm feels like it's reaching and rotating. Last one, long big breath in and up. Exhale, reach. Amazing. Again, just give yourself a second. Let the body do what it needs to do. Just release. My whole body's going crazy now. My arms, my neck, my trunk, my legs. That's it. And then release. Just keep the ball by the side, but you're going to need it with your chair this time so you can move away from the wall. And I want you to just grab your low stool. or bench or box, whatever you're using. And you're going to need a strap and a ball for this next sort of sequence. You're going to sit low on the stool, but towards the front quarter. Okay, so really try not to use the back of your chair stool box because you will slouch. You want to use the front, not so that you can sit tall with the rib cage open, but more just kind of relax down into the sit bones. Feet directly underneath you. And I want you to pop your ball right between the knees. Good. This one is very familiar, it's very foundational, sort of just squeezing and releasing that ball, but I want your arms kind of hanging and relaxing with your gaze neutral. That doesn't mean you pop your chest forwards. Keep the head directly above both your sit bones. Both feet grounded, 3-point contact of the feet down in the floor. Relax the abdominals, slight flexion in the spine, so you're very relaxed in the spine. Let's squeeze the knees. Relax. You're not squeezing from the thighs, you're squeezing from the knees. And release. Good. We're going to do 20 squeeze and release here with the knees. 3, 4, 5, 6, 7, 8. Good. 9, 10, 11, 12, 13, 14, 15, 16. I can feel something in my left rib cage kind of shifting. Last 3, 2, 1. Keep a gentle squeeze of your ball. I want you to lift and lower your heels. If you feel like your heels are a little bit too far away from you, bring them a step closer in towards you. You want to feel like you push down to lift, but if you feel like you're pushing and the body kind of juts back, that's probably an indication that your feet are too far from you. So bring them a bit closer. As you push the balls of the feet down, you should feel like you're able to keep the joint of the big toe down as you lift just the midfoot. We're going to go for 20. This is 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19. Want you to hold the heels up. Let your body release. This is an activation of the lower legs. If you start to shake, if you start to quiver, that's usually a good sign. You may feel the onset a little bit afterwards, especially if you're a newcomer to these entire exercises. But if you've been in this world before, then you should probably get the shakes almost immediately. Whatever's happening in your body, just let it. We're just going to give ourselves about a minute, minute and a half. And breathe in through the nose. And take that in breath into the back of your rib cage. Exhale. I'm getting lots of release in my neck today, which is a bit crazy. Big breathing here, just relax. Keep breathing air into the back of your ribs. $30 more seconds. If you need to pause the replay, by all means do. Let the body react. Let it just do what it needs to do for a little while if you're having a really big reaction. And then just continue the video at your own pace. For those on the live class, we're going to be another 15 seconds here. So just release, release, release. The more you let go, the more the body can do what it needs to do. 5, 4, good Mel, 3, 2. Now what I want you to do, you're going to sit tall with the hands behind your head. So we're still in a loaded position. Heels are still going to be lifted. If you need to take a quick break, you can. Obviously, maybe hips are a little bit crampy. Just do what you need to do and then just come back and join me. So we've got hands behind the head. We're going to pull those elbows really nice and open. Sitting tall, ribs down, but chest open. And then in this position, we're going to rotate. But I don't want to see knees moving. So we're keeping the lower legs loaded. You just move from the trunk to the left. Inhale, switch it to the right. And it's funny because if I'm seated, twisting to the right feels way harder than it did when I was standing. And then to the left. Keep pulling the elbows open. Less swing in the legs. Keep those legs really nice and quiet. Amazing. To the right. Open the elbows when they get to the end range. Balls of the feet down. Big breath in center. Exhale to the left. Nice. Inhale center. Exhale to the right. Keep going. Good, guys. I'm going to count you down. We're going to do 4 reps. Here we go. To the right, big breath in. Open both the elbows, especially the right. Keep your gaze neutral, chin lift. Keep the heels lifted. Inhale, center. Exhale to the left. Inhale, center. Right side exhale. Nice. Big breath in center. Exhale to the left. Amazing. Hold. I want you to relax. Arms are relaxed. Just hold those heels up. Let the body just receive these changes. They might be very vigorous. For some of you, it might be really slow. Just let the body do whatever it needs to do. Release the fingers, release the mouth, the jaw. Superb. Just keep breathing. Amazing. Release your ball. You're going to grab your strap. If you need to stand up, walk around, by all means do so. When you come back into your seated position, strap shouldn't be wider than hip distance, and I'd like the strap a little bit more up towards the knees than the middle of the thighs. And again, sitting to the front quarter of your chair with the spine relaxed, arms are hanging. Gaze is neutral, eye level. Feet directly underneath you, feet parallel. And then we're going to pull the strap, release. Pull, release. Pull, release. 3, 4, 5, 6, 7, 8, 9, 10. Last 10. 9, good, 8, 7, 6, 5, 4, 3, 2, 1. Again, we're going to lift and lower the heels 20 times. 1. So this is very much part of like an ankle sequence. If you've done or are familiar with the names of exercises, the one where we lift and lower the heels pull and release the strap, squeeze and release the ball, lift and lower the heels. And we're doing this preferably with the knees higher than the hip line. So we're really activating from the ground up, but really to realign pelvis. And in doing so, we will realign a trunk. And that basically means we get a smoother rotation, with much better load. Just keep lifting and lowering. Balls of the feet staying down. Lift from the joint. Equal pull of the legs, right and left. Making sure the feet don't start to evert or ankles rolling in or outwards. Really feel like you're trying to lift upwards with your ankles. Here's our last 5, 4, 3, 2, heels lift. Just keep breathing. Good. From here, what you're going to do is you're going to reach this right arm forwards, right fingers wide. And then what you're going to do, just in line with the shoulder, you're going to keep the left hand on your hip, palms facing down, so you're just cupping the left hip with your left index finger thumb. Heels are going to stay lifted, and you're going to start rotating this right arm over towards the left. You don't want the knees moving. If they move, I want you to press the feet down into the floor more, and then feel like someone's pulling this right arm 1 inch away from you. Breathe. In this position, you're going to look up with your head, extend the cervical spine. Exhale, look down towards the left pocket. Reach that right arm a little bit further away, look up. Exhale, look down. 1 inch further away with the right arm, up with the neck, inhale. Exhale, I can feel something all the way on my left side of the waist. Ooh. You got 2 more here, reach up with the neck. Exhale down. Last one, reach that right arm, up with the neck. And down. Release. Again, just release the arms. Let your body just do what it needs to do. Could be the head, it could be the trunk, it could be the arms. And I'm feeling a massive shift in my left diaphragm, so I'm just breathing into it. If you need to stand up, walk around, do so. Good, and then we're gonna reach this left arm. Fingers stay wide all the time. They will guide the forearm in turn guides the shoulders and the rib cage. Then from here, right hand just cups the right side of the waist at that sort of bony area on top. So you're also getting a bit of release in this kind of thumb area, okay? So I'm cupping like this, palm is flat to the floor, my index finger is to the top and my thumb wraps to the back. And then what I'm trying to do with this left arm is I'm turning the trunk. So you want to feel like you're turning through the axis of your spine. You reach over towards this left side and then feel like someone pulls the left arm 1 inch further away. Drop the chin towards your throat and then look up towards the ceiling in that extension. Good. The mechanics really matter, and the whole time we've got our heels up. Up towards the ceiling, pull the right shoulder back and down. Exhale, look down. Good, up. And down. Amazing, up. reach that left arm further away. Last two. Up. And down. Last one, long big breath in. Exhale, long big breath out. Just release. It's just 30 seconds, release the body, just let it do what it needs to do. Try to keep those heels up. Good job. Release. Release your strap. You will need your chair towards the end, so just keep it close. But for now, you can move it away. I want you to just step around the room, walk around. That's it. We're almost there. And then when you feel ready, just come and take that sort of preliminary balance test. Just checking in with where you were at. I feel longer in one side of my body, and it seems to be the left side. It's very weird. And I also feel like I'm way more loaded into this left side than I usually would be. Far more easily. Good. Okay, we are going to come down onto the floor. You need a foam pad under your head or a block. And I'm going to ask you to have a cushion or another block just to the right side of your mat. Coming to lie down on your back, knees bent. Good. Now, with the block that is over towards your right, I want you to bring it just in line with your armpit, a little bit lower than the shoulder, and I want your right hand extended out onto this block with the right sort of top of the forearm rested on the block and your palm flat on the top of the block. Fingers are wide, you're not cupping the fingers into the edges of the block. And then as you keep the palm flat, including the index finger, turn the elbow upwards. So the elbow crease of the right hand, right arm turns upwards. And then move your feet a good distance away from the back of the thighs. And then with the left palm, you want it into the floor exactly the same way. So palm down, but into the floor. So if I did this with the camera closest to me, here's my one arm, just shoulder height, or a little bit lower than shoulder height, more armpit height. Index finger, thumb pushing away, elbow crease turned upwards with my shoulder relaxed. And my opposite arm is doing exactly the same, but with the forearm and the palm rested on top of a block. Okay, so just get your orientation. I will come around to the camera in just a second. And then I want you to take your right ankle, cross it over the left thigh, figure 4. Keep both your elbow creases turning up to the ceiling, a gentle press of both your hands down and away from the body line. And we're going to take a crossover stretch here, with the right foot coming over to the left and the left thigh coming down. Left knee's going to open, and you're just going to turn your head and look over towards this right side. And you're going to breathe here. Keep the whole of the right foot grounded into the floor. Open the right knee towards the front of the room. Keep the right palm pressing into the block as you turn the right elbow up. Drop the head as far as you can over to the right. And breathe into the rib cage. So you're in a hip crossover stretch, only the right arm is elevated on a block. That's it. Mel, I need your camera a bit lower because I can't see you. I can't see you. That's it. Mel, I'd bring that block a tiny bit lower, just because I'm trying to encourage a release in your right forearm, and you'll only feel that when you compress the palm down completely. Yeah. Good. And then from there, soften the elbow a touch. There you go. And now feel like as that shoulder drops, your head can release even more to the right. And then open that right knee forwards so you get a bit of opening in that right hip. Brilliant. Breathe. Left palm's gently pushing also, but with the left elbow down. You will feel this in the forearms, in your chest, down into the ribs. And with that right foot grounded, you may even feel the arch of the right foot activating all the way up into the right hip. Keep opening the right hip forwards, forwards, forwards. Good. Breathe. You're breathing into that right rib cage, the right side of your neck, all the time. That's it. With every exhalation, see how much you can keep dropping the head over towards the right. That's it. Good, 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 good. At the same time, see if you can keep the right foot grounded and open the right hip. Superb. Just keep breathing. Again, I'm back in my setup here. Elbow is turned up, but the root of that right index finger is trying to stay down. I'm in this crossover with the right foot down, opening the right hip, and I'm just turning my head softly to the right. With the palms, I feel this push down and away, but without extending the elbows. It's more of a twist of the elbows up to the ceiling. And I'm breathing. Right hip is opening. Right foot is grounded. "30 seconds, just breathe. Find the root of that right index finger down, spread the right fingers wide, left fingers wide. Amazing. And time. Bring the knees to center, switch sides. So block will now go over to the left side. Lower, start in line with the armpit. If you find it difficult to keep the root of the index finger and thumb planted on top of the block, you move it lower, okay? So ideally, we'd want the block just like so, in line with the armpit. If it's too difficult to plant the root of the index finger, then you move it lower and you'll find that you can get it there. Okay, so that is how we're going to start untwisting that shoulder and bringing in some retraction, but also external rotation in that left shoulder, left arm. The right palm pushes down. Again, root of the index, right finger down in the floor, right elbow turns upwards. And then bring your left ankle to cross over the right thigh. And then take your crossover. Right thigh, right hip coming down. Ooh, left side is so tight for me. Opening this left hip. And then turn your head to the left. Breathe here. Plant the left foot. I'm getting cramps in my left arch of the foot, so whatever you're feeling, just keep going. A massive release on my left arm here too. Oh, my forearm is really feeling it on this side, way more than my right. Just keep breathing. It's a bit of a long hold exercise just to finish. Keep pressing the right palm, left palm. Oof. 30 seconds. Keep the foot grounded. Open that left knee more. Good, and release, 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 release. That's it, just lying in a hook line position just for a second. Palms are open, there's no equipment, we're just on the ground here. Giving the ribs a chance just to come into that sort of settled feeling. Breathing here, just last 15 seconds. Good. And then I want you to just come over, rolling off the ground. Good. And what you're going to do from here is you're just going to grab your strap and your chair for this last exercise. You're going to put the strap just around your feet. Just around the edges of your feet like so. And then you're just going to bring your chair right in front of you. Good. Just give yourself enough space to step about half a leg's distance away from the chair. Yep. And then from here, all you're going to do is you're going to pull the band, like maybe a step, depending on how lightweight your band is. You should get the legs just a bit wider than hip distance, which is perfectly fine. And then what I want you to practice is a hinge to get your hands onto your chair right sort of in front of you. So you may need to adjust your feet, and I will come around and just look at everyone, but I would prefer if I had a side view of your body into the camera. Okay, so your hands are just on top of your chair. You want the shoulders on top of your wrists. So you're pushing your body weight over the hands. And then all I'm going to get you to do is feel like you're dipping your chest down between the arms without bending your elbows, and turn your elbow creases forwards. And then what you're going to do with your heels are lift the heels, bend your knees, and hold this position. You're going to look down towards your feet, let the head hang, and then we're going to lower the heels, lift the heels. Just do 10, we're going to do 10 of those and then hold the heels up to finish. So we're not rocking the body forwards and back, and I want to see a curvature in your spine. So Mehul, what I want you to try and do is really sink your shoulders or your chest down between the thighs and feel like you're retracting the shoulder blades. Good. Drop your head a little bit, turn the elbow creases forwards. Really nice. And we're just lifting and lowering the heels here. Yeah. You should be feeling that right into your shoulders, your hips, your pelvis, but also the lower legs. And then once you finish 10, we're just holding the hands over the shoulders, shoulders over the wrists. Elbows keep trying to turn forwards. You can see here, as I lift my heels, I'm sort of putting the arch in both my shoulders and my lower back a little bit. And I'm just letting the body load. My head is released. And I'm breathing in through both my ribs. Just keep breathing. Nice. If you wanted to go a little bit further, by all means, bring the elbows or the forearms down on the chair. And just keep the bum a little bit high. Look down towards the feet and breathe here. I'm okay if you just interlace the hands and keep the forearms on top of the chair, the box. I just want your legs to feel load from the balls of the feet up into your pelvis. See if you can lower the heels a little bit. You should then get a reaction in your legs. The closer the heels are to the floor, release the head and breathe. That's it. For the purposes of this live class, last 30 seconds. If you want to stay here on the replay, by all means, pause the video and then release. Shoulders stay over the line of the elbows or the wrists, depending on your stack. Good, and release. Slowly come out of it. Slowly, 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 slowly. Undo your short loop band. What's that? Calves on fire. Amazing. Good. Finishing with your balance test and function test. So first, let's do function test before we do balance test. So we're just going to have right arm under, left arm over. You're going to turn the toes in, heels out, toes in, pigeon toe position. And you're going to turn to the left, gaze to the left. Mine feels way easier than it did in the beginning. But also, it's almost like my left toe wants to work on its own now. It's not like I'm bailing out of that left toe. And then I'm going to test the other side, so switch the cross of the arms. Feet stay the same. And I cross to the right. With ease, I feel like I'm looking over my shoulder now. Again, right toes stay pretty grounded, left toes stay pretty grounded. And then we're going to finish with a balance test. Yeah. I felt like I had something stuck in my left collarbone, left sort of pec area. Feels really nice now. But my feet feel really strong, like my legs feel really, really strong. And my neck and my head don't feel like they're rotated so much. There's still a bit of a disparity. Right side feels like it's longer, left side feels like it's shorter. But overall, the sort of twist that I had in my neck and my trunk feel like they're far less. And lots of clicking in my fingers too. Yeah. Overall, the rule of thumb is if you feel better, balance, less symptoms, less twisted, all of these things, ideally this is a class that you want to repeat later on in the week and pay a bit more attention to. Because by putting more function into your ribs and the lower legs, it seems as though your body realigns itself, releases dysfunction and compensations, and rewires.
Yeah, very balanced.